Fever in children leads to a lot of anxiety in parents, but managing fever at home is easy. Let's discuss it in 5 simple tips with me. Whenever our body is being attacked by bacteria, viruses or parasite, our body in response increases its temperature. This increased temperature is often felt as fever. Now, with this increased temperature, there will be better and efficient killing of these germs is possible. Thus, fever is a protective mechanism and it's a friend of our body. We should not be afraid of that. We all know that body temperature rises during a fever. But feeling of warmth from the forehead or the chest of a child does not necessarily always mean a fever. It has to be recorded with the help of a thermometer. Once you record with the help of a thermometer, that has to be essentially put down on a page or a paper or a record book. Once there is a 24-hour record of temperature is available with us, we can show it to physician. Physician can draw out of this a possible nature of the disease or the diagnosis of the disease. Paracetamol is one of the commonest medication used for fever. Whenever you use the paracetamol, you need to remember 2 important things as a parent. Number 1, paracetamol is a suspension kind of a drug, meaning that the particles of the drug are suspended in a syrup base. So whenever you want to use the medication, please shake the bottle well before use. Otherwise, you might end up giving only syrup base to your child and not the drug. Second point, the action of paracetamol starts in 30 to 45 minutes. So as a parent, we need to remember that we need to stay calm during that 45 minutes and not to rush for another drug or another dose of a paracetamol. Tepid sponging is one of the easiest home remedy for fever in children. To do tepid sponging, you just need a clean, safe tap water. Then take a napkin or a sponge and thoroughly wipe whole body of the child. Remember, just sponging the forehead or hands or feet will not produce that much effect as compared to whole body sponging. Remember, tepid sponging is one of the most effective and rapid way of cooling the body surface. So use it whenever your child is in fever. During fever, the body loses a lot of fluid. So we need to replenish it back by hydrating the body again. So whenever a child gets a fever, don't forget to hydrate that particular child well. For that, if the child is less than 6 months old, the breastfeeding is one of the best options and it has to be continued. If the child is more than 6 months, the other options of homely available fluids are clean, safe drinking water, lemonade, thin buttermilk and fresh fruit juices. Also remember that when a body is fighting against the disease, it needs an energy and also needs a nourishment. So don't forget to give your child a balanced diet. And lastly, I would like to request all the parents that these tips are just meant for enhancement of your general knowledge. They are not replacing the medical advices. So whenever your children are having fever, please take them to a family physician or pediatricians first. That is really important. If a child of less than 2 months old gets a fever, or if the child is having general danger signs like unconsciousness or not responding, not able to drink or breastfeed, vomits everything, or having convulsions. If any of such conditions is observed, please take the child immediately to the nearest hospital. And yes, please don't forget to give me the feedback about these tips waiting for you.